Antarctica, a land of ice, wind, and silence. The year is 1961. At the Novolazarevskaya research station, 12 scientists live cut off from the world. Among them is one man, the station's only doctor, Leonid Rogozov. He is 27 years old. He has no idea that soon his next patient will be himself. Dr. Leonid Rogozov was a skilled surgeon from Leningrad, calm, precise, and dedicated. For months, he worked tirelessly in the frozen isolation of Antarctica. Then, one April morning, he woke up with a sharp pain in his lower right abdomen. At first, he dismissed it as fatigue, but within hours, the pain worsened. He knew the symptoms all too well. Appendicitis. It was the worst possible diagnosis. There was no hospital, no rescue flight, and no way to call for help. Outside, blizzards made travel impossible. He realized that if he did nothing, his appendix would burst, peritonitis would follow, and death. There was only one possible solution. He would have to operate on himself. Rogozov carefully prepared his plan. His fellow team members, a meteorologist and an engineer, would assist him, handing instruments and holding a mirror. He sterilized the surgical tools, mixed the disinfectant, and prepared a local anesthetic. Then, on April 30th, 1961, the operation began. The small infirmary shook with the sound of Antarctic wind. Rogozov lay half-reclined, mirror beside him, scalpel in hand. He worked slowly, methodically. "It's hard," he wrote later, "but it must be done. There is no one else." At times, he grew dizzy. His hands trembled. He stopped, rested, and continued. The pain was intense, but his training took over. He located the inflamed appendix. Carefully, he removed it and stitched the wound closed. The operation lasted nearly 2 hours. When it was over, he disinfected everything, removed his gloves, and quietly lay down. In his diary, he wrote, "I am exhausted, but I feel like I've crossed the line between life and death." The next day, his fever dropped. His recovery had begun. Within 2 weeks, he was back on duty, treating others as if nothing had happened. When news of his self-operation reached the world, it stunned the medical community. How could a man perform major abdominal surgery on himself in such conditions and survive? Rogozov never saw himself as a hero. He called it simply a job that had to be done. Yet his act became one of the most extraordinary examples of human endurance, discipline, and courage in medical history. Years later, Leonid Rogozov continued to practice surgery and mentor future doctors. His life became a testament to courage, resilience, and the power of knowledge. Even in the most remote and frozen corners of Antarctica, determination, skill, and perseverance can overcome the impossible. The harsh winds, endless ice, and isolation tested human limits, yet he faced them with focus and courage. Some victories are not celebrated with applause. They happen in silence. They happen when no one is watching. They happen because someone chooses to face the impossible and refuses to give up. Antarctica remains one of the most isolated places on Earth. Its vast, frozen landscapes are a reminder of how small and fragile humans can be, yet how resilient. In this land of ice and silence, extraordinary courage and determination emerge. Stories like Rogozov's show that even in the harshest, most remote corners of the world, knowledge, skill, and perseverance can overcome the impossible. Some achievements are never witnessed by the world. They happen quietly, in isolation, when no one is watching. They happen because someone chooses to face the impossible and refuses to give up.